Alright, so for next concept in orthopedics, we'll be looking at what is known as a bag valve mask. Bag valve mask. So what is it? What is it used for? And all of those applications. So this is just it. Of course, you can see that it is used for resuscitating a patient. A patient that is having difficulties in breathing. You basically employ this to bring the person back to life. So it's also known as an Ambu bag. It's a manual resuscitator, okay, alright, device. So it's used to provide positive pressure ventilation to patients who are not breathing adequately, or if the patient is not breathing at all. Alright, so it's a critical tool in emergency, right, in medicine, and also anesthesia, also pre-hospital care. Alright, so what are the components of a bag valve mask? A self-inflating bag, right? So re-expands after each squeeze. As you squeeze, it's re-expanding, right? It's non-rebreathing valve, so it prevents exhaled air from re-entering the bag, right? It's face mask, so seals over the patient's nose and mouth. So it's so big, can cover the nose and the mouth, so that either way you can still breathe. Right? Oxygen inlet connects to an oxygen source, usually 15 liters per minute. Reservoir bags increases delivered oxygen concentration up to 100%. So how is this used? Basically, you position the patient so supine with airway opened. You seal the bag. So one hand is a CE grip, two hand tenor eminence technique. Okay, so you squeeze the bag, right, just to deliver oxygen and all of that. You monitor chest rise. Okay, so two-person technique is preferred. One of the person maintains the mask sealed while the other one is squeezing the bag. Like one person should hold here while the other one is handling here. That's the ideal one, but in emergency conditions you can basically handle this alone. Indications: if the patient is having apnea or respiratory arrest, right, having problems with breathing and all of that, if there's severe respiratory distress, okay, pre-oxygenation before intubation, failed intubation or airway obstructions, you employ all of that. Complications and consideration is it can lead to gastric insufflation, there's risks of aspiration, can lead to barotrauma, inadequate seal, poor ventilation, claustrophobia or discomfort in conscious patients. Okay, so that's just it for what a bag valve, right, mask actually mean.